Hello everyone, my name is Brooklynn Duffey and today I am presenting Angelman Syndrome. According to Medline Plus, the Angelman Syndrome is a genetic disorder that's primarily affecting the nervous system. There's oftentimes delayed development and other common side effects that tend to occur around the ages of 6 to 12 months. Individuals typically have a happy and excitable demeanor as they go throughout childhood, but they oftentimes have difficulty going to sleep. But as they get older, they tend to have less energy. They're still happy and excitable, but it's not as extreme, and their sleeping problems go away. They also tend to have intellectual disabilities, seizures, speech impediments. They usually have light skin and hair, and they sometimes have scoliosis, and they have somewhat coarse and distinct facial features. The true way that Angelman syndrome can be diagnosed is through a blood test. So now I'm going to be showing you a video, just an overview of what it's like in what a day in the life of someone who has Angelman syndrome is like.
Angelman syndrome is, well, you're born with it and you can't really catch it like a cold.
It's like one of the cells are missing on the body.
They can't talk, something can't walk properly.
You don't act older the older you get, really. You always act really young.
When she's happy, she usually flaps her hands and goes, ah!
There's about 23 of these thingies in your body, and then on the 15th chroma thing, there's a bit off.
So they're not exactly like us, they're different.
We now know that that tiny piece that was missing contains an important gene that's called UBE3A, and the gene might be completely missing or it might just not be working.
He was very poor at sleeping and very, very unsettled. He had very severe reflux and he just screamed basically the whole time until he calmed down with some drugs. But then he started smiling, and he hasn't stopped smiling since.
He's really, really sociable. He's really interested in people.
Not all children with Angelman syndrome will develop epilepsy, but most will at some stage.
They're so motivated to communicate, and that means that they will use everything they've got. They'll use any tool that they have.
My brother pulls hair and pulls gloves and he eats gloves.
When we did get the diagnosis, it was the first time that I'd heard of it, or my wife had heard of it.
She was diagnosed at 22 months old.
18 months.
4.
18 months.
He's 8 months old.
5. 18 months.
Diagnosis got missed the first time, but eventually got diagnosed at 2.5.
Diagnosis can be difficult if you're seeing a doctor who hasn't come across the condition before.
The very first paediatrician we saw was fantastic. I think it was later on that we met some professionals who weren't quite as tactful and appropriate.
Life in comparison to how the NHS website describes Angelman and how it is on a day-to-day basis is poles apart. It's extremely different.
There's a part of you that holds on to the hope that perhaps you're just imagining that something's wrong.
It's inevitable you're going to feel guilty. I feel better about it now, but it's taken time,
One of the first things we were told was that she would have a very limited life, that she wouldn't be able to open a packet of biscuits. Our daughter is very well able to open a packet of biscuits.
We've learned very quickly that you can't set an expectation on a child and say they're going to be able to do this or they're going to be able to do that. They're all different.
She says a few words, so she says hello, somebody says hello back. It's repeated constantly.
I thought people would shy away from her, as indeed some people did in the early days, because it's a very scary thing being different. People don't know what to do with difference.
Her effect on people is amazing. People get addicted to her.
When you first find out that your child has AS, your life is thrown up in the air, but it will be okay, and in fact it will be magical. You learn to deal with the challenges, and when there are successes, you become the proudest parent in the world.
Every day Eloise is always happy and giggly, she just gets on with life. Every day I look up to Eloise, and every day I try to be a bit more like Eloise as a result.
So the etiology and pathophysiology is on the same slide because it oftentimes it's the same reasoning. So, Angelman syndrome is a genetic disorder that is caused by the alteration of the 15th chromosome. It's a loss of the function of the gene called UBE3A that is located on the 15th chromosome. It's caused by an absence of this gene on from one or both of the parents. And then both parents carry this gene and are supposed to pass it on to their offspring. Sometimes one parent carry both of the alleles, and if those alleles get lost in genetic mutation, the offspring will be missing a portion of its 15th chromosome. So Angelman syndrome affects males and females in equal numbers. There's approximately 1 in 12 to 20,000 people that have Angelman syndrome. And many cases go undiagnosed because there's other diseases that have similar characteristics. And so we don't really know the actual prevalence. Many individuals who have Angelman syndrome tend to live a normal lifespan. There's not many fatal symptoms that can't be treated, but it still affects their day-to-day life and health issues. The related populations and lifespan considerations. So according to the National Organization of Rare Diseases, Angelman syndrome is a genetic condition that occurs from birth. The diagnosis is usually between birth and 2 years old, but is most diagnosed between 6 and 12 months. And then once you're diagnosed, it's a lifetime disease. There's no cure for it as of now. It can impact the individual's life immensely, as there are a lot of symptoms that come with it. Some are more severe than others. And patients that have Angelman syndrome can have seizures that changes a lot in both the mood and personality, and this is all due to the lack of the UB3EA allele on the 15th chromosome. Some related disorders to Angelman syndrome are cerebral palsy, static encephalopathy, and mitochondrial encephalomyopathy. All those three diseases all cause seizures and psychomotor delay. Mallett-Wilson is also another one that's related. They have a happy effect, prominent mandible, which is your chin, diminished speech, microcephaly, and constipation. Christensen syndrome is also similar, as it's a mutation in the SLC9A6 gene. The clinical features include apparently happy disposition, severe cognitive delays, ataxia, microcephaly, and a seizure disorder. Pitt-Hopkins is also similar, as it's an intellectual disability. It has a wide mouth and distinct facial features. And Rett syndrome is also similar, but it's just solely girls that get it, and they tend to lose function in their hands over time. It's characterized by seizures and severe speech impediment. There are actually no known risk factors at this time besides a family history, where they don't have that specific allele on the 15th chromosome. And for the medical management of Angelman syndrome, according to the Mayo Clinic, there's anti-seizure medications that can be given to patients who have seizures that are caused by Angelman syndrome. And then you can also have physical therapy to help with the walking and movement issues. Communication therapy can also be used, which they can learn sign language and picture communication. Behavior therapy is also a big one. It's used to help counteract the hyperactivity and shorten attention span that they have, so that they can be able to go to school and be able to function somewhat normally. And OTs also can help with the ankle braces, because they oftentimes have weak limbs with not much muscle tone. So giving them ankle or leg braces can help them be able to walk. Some condition-related precautions that are definitely important for individuals who have Angelman syndrome to consider. They need to be very aware of seizure activity that can occur. If they show seizure activity as they get older, like driving or being alone. Like driving or driving alone is probably not a good idea, as it can pose a huge health risk to themselves and others. Another precaution is that a patient with Angelman Syndrome and their caregiver be hyper aware of the interactions and boundaries the patient needs to know about while interacting with others, because they might not totally understand that like touching someone else isn't okay, because their mental deficits might not like connect that touching someone when they don't want to be touched can be harmful to them or the other person. And another precaution they can take is to be aware of their weakening bones if they're taking anti-epileptic drugs. Those types of drugs are known to have some sort of lowering of the muscle and bone density. This, paired with a difficult mobility, can lead to broken bones and possibly worse injuries a lot more easily. All right, and these are my references. So now we're going to get started with the activity. Hello everyone, and welcome to today's show of Angelman Syndrome Trivia. So today these contestants are Lauren and Brent. So what I'm going to have you do is I'm going to read you a question, and you're going to slap my leg, and the first person to slap it gets to answer the question. Sound good?
Mm-hmm. Sure.
Okay. So the first question is worth 2 points. What are two related diseases to Angelman Syndrome?
Rett syndrome and Christensen syndrome.
That's correct. All right. The next question is worth 1 point. What is the prevalence of Angelman Syndrome?
1 in 5 people.
That is incorrect. Angelman Syndrome is very rare. Lauren, would you like to answer correctly?
Yes. 1 in 12,000 to 20,000 people.
That's correct. All right, this next question is worth 1 point as well. True or false? More men than women have Angelman Syndrome.
False.
All right. Yes, so there's actually an equal percentage between men and women to have it when they're born. The next question is worth 1 point. What chromosome is altered to cause someone to have Angelman Syndrome?
The 13th chromosome.
That's incorrect. Brown, would you like the answer?
Is it the 15th?
Yes. The alteration of the gene called UBE3A is changed on the 15th chromosome. All right, this next question is worth 2 points. What are 2 types of therapy that can be used to help treat symptoms of Angelman Syndrome?
Occupational therapy and physical therapy.
That is correct. All right, this is the final question. It's worth 2 points and it's the tiebreaker. What are 2 symptoms of Angelman Syndrome?
Intellectual disabilities and seizures.
That's correct. And Lauren wins with a score of 6-4. Thank you for watching.